I am totally unfamiliar about, KOLs in Africa. So what is it like? What is the scene like there? Are there certain key opinion leaders that sort of you look up to and others as far as the African continent goes? Who are they and what's that like?
I think for South Africa, we've got our ophthalmological society,
Yeah.
and they're basically our go-to for everything. They are our guidance during things like COVID, especially when no one knows what to do, and we maybe rely a lot on the American Academy and what they put out into the media, in
Yeah.
terms of guidance. But our key opinion leaders basically come from that exco, and then we've also got the AOC, so the African Ophthalmology Council, has a
Hmm.
leadership development program that basically came from the AAO LDP project. And those are basically your leaders in most of the countries. The LDP program is not necessarily your YOs. There are a lot of
Uh-huh.
guys who have, they've been ex-presidents of their societies and they're big academics and so forth. So in our little, for instance, for us, we just connect via WhatsApp or we have an email thread that we communicate on. But I think in terms of the African countries, it's not necessarily direct links, if you know what I mean.
So it's interesting because we do have these popular terms now, YO as well as KOL. Are they mutually exclusive? Can there be some crossover between the two? What do you think?
There can definitely be some crossover between the two. I
Yeah.
think your KOL can come from your YO group, it can come from the older ophthalmologists. So there's definitely a crossover between the two.
For those that have not been to Africa or not involved in African ophthalmology, what are some of the things that the world could learn from Africa in this regard? For example, are there certain interesting case studies that often come out about certain ocular conditions? What would you say about that?
Definitely. I think most of the African countries are very sort of experienced in treating infectious diseases. So any sort of ocular inflammation, uveitis, that kind of disease process, we see a lot of interesting cases, whether they're tuberculosis related, um, syphilis related, things that are sort of archaic in the modern medicine. We still see those things.
Right.
So um, it's a different spectrum of disease, and you throw HIV into that, and you've got another whole area of medicine that's quite prevalent in our regions. So
Yeah.
there's definitely a lot to learn, especially if you're interested in those specific subspecialties. When it comes to cataract, retina, glaucoma, we see fairly the same as everyone else. Glaucoma, I'm not sure if you know, does have a higher prevalence in the African population, and it
Okay.
is a more aggressive disease in the African population. So the way we manage glaucoma might differ, but I think mostly infectious diseases, ocular inflammation is where you're going to find a big difference. And then our trauma. I think we've got a lot of alcohol related trauma.
Uh-huh.
Um,
Okay.
and that's what brought me to actually do the survey, because I
Oh,
noticed as soon as there was a lockdown, the public hospitals weren't seeing their normal trauma cases anymore because the government actually banned the sale of alcohol.
yeah.
So it makes a huge impact. Alcohol is it's how would I say it contributes largely to the burden of disease in South Africa in terms of trauma. Our trauma units, I think on Monday, they actually lifted the ban because we moved on to
Yeah.
a different level of restrictions. And the hospital where I did my training said that the cases doubled overnight,
Wow.
alcohol related. So stabs, gunshots, assaults, muggings, things like that.
Okay.
Um, and all alcohol related. So it's a significant burden on our trauma spectrum of disease, I guess.
In India, I remember seeing cataract surgery, and they're so fast with cataract surgery there because there's so many patients, right, with the backlog. What do you guys do well in Africa that the rest of the world can learn from?
I think we've got similar cataract outreach programs, so rural outreach programs where we go and address backlogs in areas that are not well serviced,
Mm-hmm.
in South Africa specifically. In terms of everything else, sort of comes to the urban areas, if you know what I mean.
Uh-huh.
Cataracts. I think because it's obviously a blinding condition, patients aren't very mobile. Their quality of life is affected. They're not as free to leave their homes to go seek help. So
Okay.
we have quite extensive outreach programs in all the different regions. There's a bureau
Right.
that does it's volunteer work, obviously, at the end of the day. The Bureau for the Blind in South Africa runs most of these programs. And then I've got a YO colleague that actually started up a cataract facility. It's in the northeastern region of the country as well, close to a lot
Hmm.
of the safari areas.
Yeah.
And it's an amazing program. For instance, he's basically gotten such huge sponsorship. Any equipment that you can think of using in the first world, they've got there.
Mm.
And they invite surgeons from all over the world to come and operate there. And the bonus is that you get to stay in a safari lodge and you're on a sort of game park. So in your free time or your off time, you can go and do all of that and check out the scenery
Right.
and look at the animals. So there's a lot of programs like that. The one that I do is called Flying for Life. It's run by a company called SOS, and they do outreaches that are basically a day. So you fly out
Hmm.
very early in the morning, you go and do about 20 cases, and you fly back in the afternoon. But that one is quite regular. The other ones are usually monthly. But I
Okay.
think cataract outreach is our main sort of outreach kind of program. Everything else we sort of bring to the urban areas, and we function very similarly to first world settings.
What are the major, I would say, countries that are involved in terms of outreach to Africa that you're aware of?
Some have you heard of mercy ships?
Yeah.
They come. So they're the predominant one. They've also set up sort of almost a permanent clinic in the Transkei, which is one of the rural areas in South Africa along the coast.
Uh huh.
But they're very involved with South Africa. They're very involved, and the Fred Hallows Foundation is also quite involved. They
Right.
do a lot of equipment donations, lens donations, things like that. So they're also quite involved.
What is your subspecialty, Sanushka?
So in South Africa, we sort of train as general ophthalmologists, and then you
Mm-hmm.
sort of practice in whatever field you like, I guess. So for me, I do cataract surgery, I do glaucoma, I do medical and surgical retina, and obviously trauma, because we need to
Yeah.
be able to manage those. Yeah.
Sometimes in Asia, we have case studies on Asian eyes, which are a little different than eyes in different parts of the world. I think you mentioned glaucoma is a
Hmm.
prevalent issue, particularly in Africa.
Yeah.
Are those in a certain subset of ethnicity in terms of eyes in Africa, or is it just affecting the whole continent for a particular reason?
I think for primary open angle glaucoma, stand to be corrected, but I think it could be sub-Saharan Africa.
Uh huh.
Um, where you have a 6 times higher prevalence of getting the disease, just purely because of your race.
I'm curious as to Africa overall. I mean, is canaloplasty quite prevalent throughout the region, or is it more in select few that use that?
I think we all get trained to do it because we see it so often in our trauma cases. I think when I was training as a resident, I did about 22 on my own. You
Mm-hmm.
get taught by your oculoplastic or orbital surgeon how to do them, and they
Okay.
sort of supervise you. And when they see you've got it, then you do it on your own.
Right.
But it's definitely very common. It's very common because a lot of our traumas are stab related, or
Mm-hmm.
the knife would have been the weapon of choice, I guess. But
Okay.
as a result, they get a penetrating globe injury with an upper and lower lid injury. So
Yeah.
most of the time, if it's more medial, they're going to have a canalicular injury as well. So we do get trained to do that.
Right.
I guess not everyone loves it, so it's obviously a preference as well. But we are very much exposed to them, to those kind of injuries. The gunshots that we see are usually illegal weapons. They're not registered or they're stolen. And
Mm.
it's usually thugs that are carrying them around, or it's a car hijacking gone wrong, or a mugging, or just intentional like bodily harm.